Thank you.
So,
Thank
Naman to our great Lord Dhanvantari, to all my gurus and my parents, and I start my presentation. So, today, as everybody knows, it's principles of treatment in PCOS, Ayurveda view. We have been treating PCOS, all of us, by one means or other, but whatever I could gather through whatever principles I am adopting from our Shastra, I have just tried to present it before you. As Charakacharya says, that is the true medicine, that is the true physician that can cure and eradicate disease. So here in PCOS, our main goal of health promotion is focusing on the lifestyle first, leading to positive health behavior. I would like to emphasize on this positive health behavior and health promotion strategies. So as per our Charakacharya, if we focus on lifestyle in today's cutthroat competitive world, we always focus on how best we can go ahead. It's not that. It's the time that we should be learning about contentment, satisfaction, whatever comes to you, and be happy for others also. All these things are taking a backseat. And that is where our mental health is suffering, where we get irritated. Why are we not competent enough like others? So this is not at all advocated in our science. You have to be happy because every personality is different, and this is what is the focus needed today. So I'm sorry to say, with the bifurcations in the family, the nuclear family taking a stand because of the reasons unknown, there are so many various reasons, because of migration and all, the nuclear family will emphasize on the progeny, whatever how much they know, the experience and the moral ethics. Only few go on with it. The rest of them are always teaching their progeny and the siblings together, only focusing how best you can do and how best you are projected. So this was not in the joint family culture, which is lacking, where you share, be happy with your cousins. All this is lacking. And so, my dear friends, we need to focus on this. This is what our Acharya also has told. Eradicate the disease. We can eradicate the disease by giving physically some drugs, but mental health is equally good and important in Ayurveda. Why there is no mention of PCOS? Were they not aware? So there are references but different names because it is only conditional, it is symptomatic. And again, you have seen PCOS will go with the lifestyle, with the medication. Once the patient conceives, again it relapses because of the lifestyle and some positivity lacking in the mental status also. So to understand what its name is in Ayurveda, it is Arthakshaya. What I feel, because Arthakshaya, whatever lakshanas you're seeing in PCOS, you're finding in Arthakshaya. So it is the Kshaya of where our acharyas have explained Yathochit Kal Adarshanam, irregularity in the its untimely appearance. Adarshanam Alpata, scanty. Scanty in flow, scanty in duration. When it was 4 days, now the duration is 3 days. If the patient was using 3 pads, now she's using 1 pad, 2 pads. So this, both the things, everything listed under one. And one more principle, in 10 more years, there will be more research with PCOS, there will be some additions and Yoni Vedana will come then. But our people have told it before only. So this Lakshana is not yet come into the conventional science. So we follow them, and therefore we have put down Ayurvedic principles of treatment of PCOS. Okay, so that will be appropriate. But I have put as principles of treatment in PCOS. So here, what is the difference? Because we are understanding from their terminology, their diagnostic point of view, that we are focusing like that. Okay, so Arthakshaya, we have to follow few principles. Samanyam Vruddhi Karanam, Arthavam Agneyam, Swayoni Vardhan Dravya Chikitsa, Agneya Dravya Chikitsa, because Arthavam is Agneyam. Wherever there is lacuna in the Agni, in that part, and then definitely PCOS results, because physiology is altogether important for us. As physiology goes, we focus on the principles. Agni is important for us. From Agni, so there was a session in the morning. I'm sorry, those who are listening to me in the morning and today afternoon, there will be a bit of similarity. So Rasa Dhatu formation is important for us, and we are already going up till Rakta Dhatu, because Bhav Prakash says Rasa and Rakta, through which the Om is formed. Rasa Stanyam Tato Artavam. So Raja and Stanya and Artav all forming from Rasa and Rakta. Rasa's Malarup is Kapha and Rakta's Malarup is Pitta. So these two things have to be considered while treatment. Then Rasa Rakta Mans made Asti Majja and Shukra are Artav in the females. So everything goes with our principles of treatment. When you treat a patient of PCOS, the history taking is important. The Darshan Pariksha, the Sparshan Pariksha, and Prashna Pariksha. What they do right from the morning to evening is important. In today's life, you have to start, when do they get up, what do they eat, when do they eat. So where we are correcting, the first slide, what I told you was correction of their lifestyle. Then give them positive behavior. Most of them are into depressing mode, negative mode, where they feel helpless to the situation. And there are some programs going on in the mind. How to belittle and get ahead. This is also one wrong thing which is happening, due to which the mental attitude suffers, Agni suffers, and the conversion, the bioconversion suffers. Now, Arthav is what? For us, Arthav is hormonal chemistry. Arthav is not only ovum. Arthavam is not only the menstrual flow, but it is the whole chemistry. So Arthav serves the purpose of Dhatu, also as Upadhatu and Mala also. So the Artha Dhatu is whatever functioning is going on into the endometrium, the ovaries, and the whole hormonal chemistry comes under the Upadhatu. Dhatu and Upadhatu collectively, whatever estrogens, follicle stimulating hormone, the luteinizing hormone, everything comes under Artha Shabd. And the Malarupi Artha is what we see as menstrual bleed. So why I'm going into the physiology? Because this is what is our principle of treatment. We cannot say we are into gynops. We cannot forget the basics of Agni, Kaya Chikitsa, as well as Sharira Kriya, Sharira Rachana, both together. So here, Utpatti depends, the Om's Utpatti depends upon the Kal. That is Yathochit Kal. Dhatu Paripurnata. Why Dhatu Paripurnata? Even if you are taking a good diet, that bioconversion is important, as we have seen in the last slides. Rasa Rakta Mas Medasti. So if the progression stops at Medas, then we all know obesity rises. And here from where Agni is more Vruddha and the Asti is weak, the Majja is weak, and the Arthav is weak. That is, the hormones are also weak. Karma, Swabhav, and Vayu. For everything, all these things, the correct Vayu is important. That is why we give Yoga Basti as Chikitsa, because Vayu is important for proliferation, for Utpatti, Sthiti, and destruction, for liberation of the Om. Everything is under Vayu. Therefore, our principle is keep Vayu in the check. And Chikitsa is, Ardha Chikitsa is Basti. Now, Rasa Vruddhi. Why I'm talking about Rasa Vruddhi in principles of treatment in PCOS? Because I told you, Rasa Stanyam Tato Artavam. And this is where we are going to look into Rasa Vruddhi Lakshana. Now, Vruddha Sleshma, Agni Sad. See, Agni is important for us. You treat the Agni, Agni, and Agni. Because during Rasa Vruddhi, Agni Sadar, Prasek, Alasya. So most of them are lethargic today, and vice versa. This Rasa Vruddhi causing Alasya and Alasya causing Rasa Vruddhi. Gauravam, Shwaityam, Shaityam, Sthalangatvam. Now this is very much important for me, the flabbiness in the body. So all these Lakshanas, I would like to say, rather Agni is not formed properly. The bioconversion is affecting, And what happens is all the endocrinal system is disturbed. So here you find these things going towards thyroid also, where you find all these shaitya. In hypothyroidism, the patient suffers all these lakshanas. Shwasakasa ati nidrataha. So the treatment will be, the principle of treatment here is identify if the patient is having these lakshanas, not with the diagnostic test. What is the Rotterdam scale giving you? Only out of 3, 2. That is USG, anovulation, hirsutism. So if you see these things and 2 are there, then you say it is PCOS. That is all you are getting. But when you go into deep, when you find the cause, you can treat properly. That is when what is more enhanced, you go for Basti. When it is Rasa Dosh, Rasa Vruddhi also, please go in for Deepan Pachan of Rasa Pachakwati will be helpful. So here the Viruddha treatment, our basic principle is go with Nidan Parivarjanam. So here the Viruddha treatment will be Lekhanam, Deepanam, Pachanam. After that, Lekhanam is important. Now, Rasakshaya. So we see 2 types of PCOS now. One is lean, one is obese. Obese will go there, and now lean is totally Vataj. So here, do not give Basti initially. Here the treatment will be Preenanam. Why Preenanam? Because Rasa Dhatu does Preenan, the cells have shrunk. With the law of the physics, we know whatever goes into Kshaya, air enters there. Once the air enters there, that is what? So our Tridosh theory, the basic principle, know how the Tridosh are playing in the body. If they are in Samavastha, fine. If they are Vruddha, do it down. If they are low, get them up. So here you can identify the patient with Rasa Rauksham, Shrama. So here Dashavidha Pariksha will be helpful, where you ask the patients, how is her Sattva, Satmya, Samhanata, Shosh, Glani, Shabda Asahishnuta. The patient usually is lean and thin. Here go with Preenan. So most of the time, if you give Shatavari Ghrita, today I'm not supposed to discuss drugs. I am discussing only the principles. But here one example I felt like giving is this. So this is how you do a Preenana Chikitsa. Madhur Ras जाकर के उस सेल को विकसित करेगा जो श्रिंक हो गई है ड्यू टू ऑल लक्षणों ऑफ रस धातु क्षय. Whatever stress we are taking, whatever gati we are doing, gati gandhayo vayuhu, all these things will shrink the cell size. Now, rasavaha sroto dushti. After these 2 things, I would like to discuss rasavaha sroto dushti lakshana. Here, guru, shitam, ati snigdham, ati matram, sama ashnat. If they do all these, then rasavaha sroto dushti occurs. Nowadays, whatever lifestyle we are adopting, the cakes, whatever burgers, the clearance takes time with maida. The pizza, the pasta, everything will all, and we take it right from the fridge, okay? So we like cold ice cream, we like cold drinks and cakes, which are all iced and directly from the refrigerator. So all these things with cream, lots of ati snigdham, ati matram, because you're not working out and you're having with the same capacity. So workout is less and the capacity of eating has become more. And therefore, rasava sroto dushti, the treatment will be viruddha, that is nidana parivarjanam. Now go with the principle, Ayurvedic principle of rasava sroto dushti is shastulekhanam. Go with woman. So many of our PGs, many institutes in the country are doing this chikitsa of in PhD and PG level also. You find they are going with woman chikitsa and they are finding the difference. So why woman is the answer? Because of all these lakshanas. Now, arthav dushti causes. Let us find only the word arthav. As I told, the whole hormonal chemistry is in arthav. That means the formation of the ovum, the formation under pituitary, the GnRH, everything is arthavam. So arthav is inflicted by dosha, tribhi doshaihi. यानी दोष जब ऊपर नीचे होते आहार विहार से. So we all know, we are students of Ayurveda, क्या खाने से वात बढ़ेगा, क्या खाने से पित्त बढ़ेगा, क्या खाने से कफ बढ़ेगा और कौन से विहार से ये तीनों बढ़ेंगे और किन चीजों से कम होंगे। यदि ये तीनों में ये दोष अधिक हो जाए, देन आर्तोदुष्टि occurs. वात आदि, अष्टांग हृदय ने इसी बात को वात आदि कहा. Now, one more important thing last is Kashyap Samhita says Ati Ushna. Even Sharandar says Ati Ushna Annapana. So Ati Ushna Annapan, what we are having it today. Sometimes we have iced things and sometimes we do have Ati Ushna Annapan. And these things are causing doshik levels differences in Artavam. Now, Artha Vapat, why does it occur? Vruddhata ko prapt hua, quality nahi. I will not go if ovulation is occurring or not. I told in the morning also. If you go for sonography, what we see? Yes, the ovum is liberated, but no conception this month. Okay, we have done all these efforts, but it is failed because there should be quality ovum. So nobody has yet given the quality in the modern medicine. Our people have told us what is the quality. Dvibindatmak, what is the quantity? Both. So the vruddhi depends upon ahar, vihar, parinaman. Kshaya also depends upon ahar, vihar, achar, kala, parinaman, and main of it is artha. Asatme indriyartha samyog. Nowadays, we know this causes obesity. This causes problem. As I told you, our body is a dustbin. Daily clearance is required for good bioconversion. So if you do not eat things which are congenial to you so that you can evacuate tomorrow morning, then what happens? All the things which are neo-cultured nowadays, what we have imbibed through the West, I don't say once in a while is wrong, but most of the times, easy food, we are just ordering and taking. The oil which has been used there is boiled twice. The fatty structure changes. Our Shastra, in Pak Shastra also, they were very well versed. They used to say, once the oil is boiled, do not reuse. But for samosas, for the rest of the things, we see vada pav we are having. Many a times they are going on just taking out from the same oil. So deep frying in the same oil will go and clog your system. The clearance from maida is 20 hours. For pizza and all, it is 48 hours. Most of them now going in for non-veg, who were vegetarians initially, now going for non-veg. So in that also, adaptability of the intestines. All these things gives a less clearance. So as the system is clogged, it is not clear, the hormones, the shrotas, everything is affected because the metabolites are staying there, not allowing the proper function to occur. So this is asatme indriyartha sanyog. Karma, pragya pradhi dhruti smriti. Whatever we are doing, we know this is not good for us and we are taking it again and again because we love it, and that is causing the problems today. And the children do not like if you tell all these things because, again, nuclear family, the joint culture, ordering business, both parents working, they can't help it, no cooking at home. All these things are a factor to be known and which have to be cleared through our principles only. Imbibing our culture is important here. Bija upaghat occurs because of srotosang, vata sankshop, and dhatu kshaya. Our people have given it very, very clearly. How? So I have explained you srotosang. Once srotosang, avrodh, vata sankshop occurs. And vata sankshop, the adi dhatu, the next dhatu has to be formed, which will not form, and dhatu kshay. So we have these references in Revati, Jataharni, Pushpagni, Ashtartava Dushti, we have some Dushti in Artav. Because of Ahar Vihar only, Avaran, use of Tikshna Virechan in Mrudukosh also causes Bijopaghat as per Dalhan, Tika on Sushrutam. Asruk Dosh. So all whatever we are eating nowadays will cause Asruk Doshas, dietary habits. Why dietary habits? Because while driving a car, we are just munching out. While sitting before the computer, we are just munching out. You are talking to someone and you are eating on the table. So, Prasanna Man Atma and Ashtavidhi Visheshaitan of Sanskar, of Rashi, how to sit, all these things lost. You sit on the sofa, we eat. Now, I'll be demonstrating you in the next slides. So, and one more thing is Artava Sroto Vidhata. They also cause infertility, Vandhyatva. And Vandhyatva comes from Bija Upaghat. And Bija Upaghat is Artav Nash. And Artav Nash occurs in PCOS. This is what we are trying to learn. Rasa Pradoshaj Rog. In Rasa Pradoshaj Rog, I always emphasize because metabolism, once the hormone chemistry is disturbed, the Artav is disturbed. The Rasa Pradoshaj Vyadhi are equivalent because our people say Nidan Parivarjan is the answer. If you do not go slowly, Jwar is the main thing which reflects in many diseases. Next, if you see Kasa, Shwasa, you get Jwar. So that way, Jwar reflects in many. Or sciatic pain, rheumatic amuvat, Jwar. In the same manner, many of the diseases, Prameha is the Janani. Now, Prameha, Dasadushya, Manda Agni, Santarpana Janavyadhi sometimes, most of the times. So here, first dhatu is affected, that is Rasa. And you find all Ashraddha, Aruchi, Asya virus. These are all pre-monitory stages occurring in PCOS. But the patient ignores and again it's Bhukta Syo Paribhuktam. So you are not following the timing. And then also the principle deflects. Now you have to, in corrective measure, you have to find a way by means of correcting the timing also of eating, the way they eat, complete devotion to the Anna and be happy with what you have got and then eat. So this is how we are going to clear by our principles. Arasangyata, Rilas, all these I won't read. Here, important I have marked in red. Pandutvam, Srotasam Rodhaha, Clybium. This is the biggest thing which will tell you infertility occurs after PCOS. Infertility occurs in diabetes, in male or female. Clybium, Sadaha. All things coming very slowly to an standstill and no hormones coming out of the Shrotas. Shrotas means each cell, as I told you. So all these things will go on with Rasa Pradoshaj Vyadhi. Now, Hetu. What are the Hetu? Now we are still understanding the physiopathology. Then we go with principles. Once you understand this, we can go with the principles very easily. Charak says Bija Ansh Dushti is the reason. Sushruta says, now I have clubbed all the reasons of infertility into PCOS because one factor of PCOS is causing infertility. So whatever are the causes for infertility which are related to PCOS, I have clubbed it here. Yoni Vyapat is also the answer. How we will see how simple Yoni Vyapat will also deflect the doshas. Tribhir dosha. And this dosh, once they are not corrected properly, they reflect on the system, from the reproductive system into the whole Shariraga. So Vandhyatva, Artava, Sroto, Vidhalakshan, Kashyapa says, Pushpagni, Vataro, Panchakarma, Upadrav. So if you take Nasya, when you have taken head bath, and that time, so today's topic is not this, so I won't be mentioning, but Kashyap says, this deflates the pituitary hormones, and this, no matter, now here we are taking our head baths as and when we want. So again, this is one point to be noted, which is causing Harita, Dhatukshaya and Ajat Sar. Bhel says Bija Dosh, Apatya, see main, Vega Dharan. Today we find the answer in Bhela Samhita. As good, all, Vayu. Then the Ritu Kshetra Ambu B should be good enough to maintain Artava chemistry, hormonal chemistry. Manasik Bhav. If you are doing shok, indirectly, whatever Manasik Vikruti you are undergoing, definitely in small quantity also it is going to reflect on the Bhav. Hello? Hello?
Hello, ma'am.
Hello? Am I audible?
Yes, ma'am.
Yes. My net is giving issues, I suppose. 1 second. Give me a second, please.
Okay, ma'am.
Sona? Please bear with me.
Yes, ma'am. Take your time.
Yeah. There is net issue.
Yes.
I'm trying to join through my mobile. Just a minute. Yeah. येत आहेत ना. ये. Just please help me. Slow चालायला. पुढे जाईल. Why? But they are listening to me. 1 second. I'm sorry. I'm just going on. Let to show. कर लॉग इन कर त्याच्यात. फास्ट कर. आताचा पासपोर्ट. I'll just close in and share again otherwise.
मैम कौन से नाम से ज्वाइन हो रहे हैं? आपको को
हाँ.
होस्ट बनाना पड़ेगा.
किसको?
आपको को होस्ट
हाँ,
बनाना पड़ेगा.
ऐश्वर्या कुलकर्णी.
ओके 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 मैम.
या तो मेरा नाम डाल दूंगी तब तक.
ओके ओके.
हाँ, आई एम ट्राइंग टू शेयर अगेन माय पीपीटी. वापिस से कर रही हूँ फ्रॉम द बिगिनिंग. मीटिंग आईडी 1 second. 1 second, I'm giving you 581 354 6201. सांगितलं. आ गया. डाउनलोड माय पीपीटी ऑन फ्रॉम. शेअर कसं नेट कार्ड. माझी पीपीटी काढ जीमेल मध्ये. काढ नाही व्हायला. आय एम ट्राईंग. तू काढ त्याच्यात. नाही तर हे पीपीटी ह्याच्यात काढते. काढ जीमेल काढ. सडनली का झालं? नीता म्हैसेकर 19@. gmail.com. बंद होऊन काय यायला? चार्जिंग आहे ना सोना? आहे ना? gmail.com. झाल्यावर ते इन्स्ट्रक्शन द्यायचं. निमा फोरम फायनल. निमा फायनल म्हणून मला दिसत. निमा फायनल आहे. मला करून दे. Again share from here. Comes I'll do from here. My final four. Now it's working. Share the screen. इथे share screen. हे आणि share म्हणा. But it's not moving. That's my problem. Enlarge ना. एक मिनिट slide show करा. नाही, slide show from the beginning. Now if it moves, I will continue on this. PowerPoint. Are you able to see? Hello?
Yes, ma'am. Yes,
Yeah.
ma'am.
Yes,
Yeah.
ma'am.
हाँ, तो भी ये सेव करके रख. जीमेल फाइनल निकाल के रखो उसमें. Yes, I'm sorry. I'm really very, very sorry.
It's okay, ma'am.
Yeah. Now, so we finished doing Hetu. So pathophysiology, I'm almost done. Lakshanas, I have explained you. Why does this occur? So we have been told doshai avrutta margatvat. Nashyati striya. Artavam nashyati striya. So here do understand not only Om, but it is whole hormones. Doshas involved are Vata and Kapha because Pitta is Drava. But I told you, without Pitta infection, without Pitta in the Agni, if it is not proper, then only it will vitiate Vata and Kapha, which will cause Avarod. So Avarod Karak, only Vata and Kapha. So Vandhyatva is Nashtarthavat Vandhya. So what is Vandhya? Here Arthavah Sroto Viddha Lakshanas, Sushruta has mentioned Vandhyatva. So in Vandhyatva understanding, he says the patient had flow proper, but now that Arthava is lost. So we are calling this patient as Vandhya. It is not that it is not treatable. Absolute condition nahi hai ye. This is only that the patient had Arthav before, but now due to reasons, whatever, she has lost Arthav. So she has gone into a mode called Nashtarthavat Vandhya. So it is a part of PCOS. Next, I will not explain because this we are not concerned. Maithuna Sahishnata Arthav Kshayam Cha. So in understanding Arthokshayam, it is about hormones and ovum both. Now, this is the thyroid, the Merkel, which I have downloaded, symptoms given by Merkel of American Association of Endocrinologists. All these things you find in the Rasa Pradoshaja Vyadhi, what we have given: gaining weight, losing weight, constipated, hypothermia, shaityam, shwaityam, sthalangatvam, feeling fatigue, lethargic, alasyam, brittleness, everything has been described by our people in Rasa Pradoshaj Vyadhi. Coarse voice, acne, everything coming down, irregular menstruation, clybium, what all we have just learned. Now comes the principle of treatment. How do we treat PCOS? So first, proper history. Then we understand Sama Dhatu, Sama Agni, Sama Malakriya. Prasannatmendriya, Mana, Swastheti Vidiyate. So only this is important for us, how the dhatus to be maintained, Sama Agni to be maintained, Malakriya. If it is the dustbin, if it is empty, the body maintains its functions. That is for sure. So Vriddhi Kshaya Lakshan, if it is Vriddhi, then go with the gunas opposite. If it is Kshaya, elevate. Like example, Madhur, Amla, Lavan, Ras will increase the Vata content. If it is Kshaya, if you want to do Prinan in PCOS case, that time you will go with Madhur, Amla, Lavan, Ras in diet. And Gati should be stopped because Gati Gandhayo Vayuhu. Stress should be stopped. So because Rasa Dhatu Kshaya and Vat increases. So you have to understand what exactly is going on by counseling and by confiding in the patient that she can tell you everything. So this is how we treat by taking proper history. Samanyam Ekatvakaram Visheshastu Viparyayaha. So what are the reasons due to which the patient is going into this mode should be stopped, and exactly opposite gunas, as I have told you, ahar and vihar should be adopted. Now, how this has to be done? I have also told you the reasons, the pragya abhrat and artha. Whatever the patient is consuming, however the patient is behaving, is going to reflect in the body. So here, as per the desh. So desh is very much important in ahar and vihar. The migrants, mostly those because of the jobs, they are migrating and adopting to whatever conditions are present in that particular region. Understood? So the staple food will differ from that proper dish to another dish, and this is going to hamper and affect the total health. So Kal, see, I told you when Ashtavidhi Visheshayatan, what are the timings, what they are following for eating, sleeping pattern, circadian rhythms. So all these things are important for us, which have been explained by Vayohratri Bhuktanam. Te anta, all in that you have been explained Vat Kal, Pitta Kal, Kapha Kal. So mostly whenever we are having our lunch, we go by the timing 1 to 1:30. Even in Ayurvedic college, I always feel given a position, definitely I will try to implement this point. Our Pitta Kal, in some, it affects from 11, 11:30, 12, 12:30, and after it has gone down, we sit down for lunch and have. Then what happens? The bioconversion is affecting. The Pitta was very high, and at that time you have not given it the food, and when it has come down, you have given. So how the bioconversion is not going to affect? Definitely. So I am going to request the authorities, given a position, as I told you, that whoever would like to have the food when the 10 minutes they can consume. I mean the teachers, not the students, because the discipline will go haywire. The student has to eat and come. That is the law. So here, Desha, Kala, Bala, Sahaja Bala and the Bala. Bala has to be maintained by yoga, by ahar, by vihar, and by exercise. So the Bala is already affected today because most of the students, the children do not have a ground to play proper, and most of them after coming home in this cutthroat competitive world, they would like to go for a tuition. They do not want to play. So how to maintain bala? How to enhance the capacity, the stamina? Nothing. So Desha, Kala, Bala has, everything is getting affected. Ritu, the seasons. So as per the season, the diet was there. Our diet was completely in congenial. The tropical country, India, what it is, has got perfect. I will give an example. If you go to Gujarat, the coastal region, if you go to Visakhapatnam, if you go to Madras, all are coastal regions, but where there is Ruksha Vayu, more intake of chas in Gujarat. So, snigdha, and which is not going to affect the dehydration in the body. So, you find chas very popular in Gujarat. All these are coastal regions, but dahi is popular in south. And if you migrate to Maharashtra, as I'm the sole example, once migrated to Maharashtra from south, my diet, which was completely with dahi daily in the morning, not in the night, because we are Ayurvedic students, dahi is not allowed, but in south they eat. So it becomes satme. Once I migrated to Maharashtra, the pitta shoots up because dadhi is abhishandi plus ushna, and sinus takes place. The secretion, dravaguna of pitta will increase. So all these things, this is one example I have given. I always give an example of Punjabi food, which is very rich in protein. In the cream is used, kaju is used, paneer is used. Punjabi people, they used to work very hard in the fields and they eat properly. Here you're sitting down in the city and having Punjabi food to the fullest capacity. It will not be allowed. Similarly, coastal, all the coastal foods, they are good in their own region. So here, season, region, kal, and bala, everything matters. You have to be very careful with all these while treating, and these principles have to be kept in mind. You identify the patient's prakriti, you ask the desh, you ask the daily dietary habits, and arrange your prescription accordingly. Jara, pramay have to be looked into. As I told you, Jara, if you give Shadang, all these Shadanga Paniyam, most of the patient gets very much good relief with Jara treatment, that is Shadanga Paniyam. In Prameha, while treating Prameha, we use Vidang, we use Guduchi, so we use Shunthi, we use Amalaki. So wherever required, you adopt the principles given in Prameha. So that is the main thing with Dasa Dushya. It is the thing which is causing Rasa Pradoshaj Vyadi and next leading to Prameha like conditions. With sedentary lifestyle, with lack of exercise, with eating more, Asya Sukham, Swapna Sukham, all this is going on very high these days, and due to which we are supposed to adopt Prameha line of treatment. Next comes yoga. Now, yoga is everybody is into yoga nowadays, and yoga, we all know it is not only exercise, it is chitta vritti nirodhaha. So how many people are getting this training of chitta vritti nirodhaha, of being contented, asteya and parihar, all these things, how many people do adopt? So this is a mental exercise. As you do daily yoga, the dharana shakti increases. Once dharana shakti increases, then you go into more of concentration and you get the buddhi of virtue. What is good, what is bad. The vivechanatmak buddhi. So this vivechan, if you get, then you will be morally very high. Once morally high, no guilt. No guilt, you won't do any mistake of pragya apradha also. That control, that self-discipline power comes. No pragya aprad of ahar, vihar, achar. Then the patient is fit enough mentally and physically. And sharir, man, when they are okay, whatever the patient ingests will definitely convert into proper dhatus. So this is how yoga should be explained to the patient. The patient should be given these values while you are writing a prescription of PCOS. This is very much necessary in today's world. Pathya apathya, as per, if it is satme for them, eating pizza daily and clearing properly, fine. But pathya apathya, as per Prakruti, satmyataha, desh kal, specifically to that particular vyadhi should be looked into. What can be best given to the patient should be looked into. Then which pancha karma to be given? Vaman, Virechan, Yoga Basti, what is best in this season are simple nasya. Daily nasya, snehan will help in few patients. Vatahara Chikitsa is another principle of treatment. So wherever you see Lekhan is required, Vata is more, at that moment Vatahara Chikitsa is required. Suprajanan Chikitsa. So adopt Suprajanan Chikitsa. Why? Not only infertility, this is good for the hormones. So go on with all the principles. Of course, without drug, the treatment won't be complete. So drugs is in. I keep above all the Ahara Rasayan, the Achara Rasayan. Sadgrut Varnan given in Charak Sahita should be adopted completely and counsel again and again to the patient. Until then, you won't find, because small irritation levels are so high. Patience is less nowadays. Sharing is less, patience is less, irritation is high. So tapa santapa iti pittam. Suddenly the pitta rises, again comes down. Pitta rises, come many a times in the day. So how the hormones are going to be maintained properly? How the dhatu, how the shakti of the buddhi, mana, how can you become prasanna atmendriya? It's not possible until you have this control in acharan. So we know ahar is really important for growth, development, enhancement of all dhatus, and ojas, of course. That is the immune system. So we get autoimmune disorders nowadays. So this all can be avoided, and this is how you can treat PCOS in one way, by giving mental strength. The Indian cuisine is replenished with natural nutraceutical. This is another principle to be adopted, wherein til, sesame, you have to use it daily, whoever has, because vata will not go hyper except for pitta prakriti. You can use til mostly. How much til? In our Indian cuisine, we have not told one full big fistful of 2 spoons, 10 spoons. No, it is only on the roti that we sprinkle a bit of til. In few curries we sprinkle. So in that way, women used to get good amount of estrogen, because til has snigdhata, vatahar, and it has got calcium binding capacity. The estrogen is retained, and this is how, this is one principle of treatment to adopt as per desha kal. As I told you, region, you have to mention what the patient has to eat. Okay, so this is how the food enhances vitality, strength, sturdiness, enthusiasm, everything in the patient. Now, vinapi bheshajam vyadhi pathyadeva nivartate na tu patyam vihinasya bheshajanam shatairapi. So we all know there is no need of bheshaj. Ahar only is the treatment aspect for iron, calcium. We have not given anywhere. Our people have told anemia is there as a disease, not as a symptom here. So here, in many of the females in today's world, we find it as a symptom because bioconversion is lacking. So there, if you give proper ahar, proper absorption capacity, and that enhances the quality and quantity both of the raks and rakta to maintain PCOS not to come near in the patient. So the daily intake to maintain Shuddha Rasa Rakta, all this is necessary to maintain the hormonal balance. So this is naturally occurring in all Indian cuisine. Only thing is, we have left this and we are ordering from outside, where we lack dry coconut, where we lack asafoetida in all the things, where we lack methi in all the things. I would like to give an example of Indian cuisine, the principles of following why we are discussing today. If we had taken the natural course of our wholesome meal, there was no need of all these discussions today. Whenever we prepare bhendi, Bhav Prakash mentions you have to add methika. So why? That is, I'm leaving it to you how best the combinations have been given. When you go with til good. So all these are very important. When you go with dry coconut with good. So all these, this is the prasadam what we offer to Ganpati. So there is a meaning in everything where the society should be healthy too. So the principles were followed. Bahadi sahajita se follow karte the. And people were God fearing. Therefore, all these Naivedyam, Prasadam came into existence. Without that, nobody would share as what is happening in today's world. So the mandatory protocol to be followed, proper history taking, Dashavidya Pariksha, the Rogabal. Rogabal means we are not looking into only PCOD, hirsutism, androgens. We immediately comes to mind. Androgens have to be done with. How to do? So spironolactone, we know immediately. But for us, Rogabal, you have to do the parikshan of the patient and find out by the history how much is the Rogabal, how much is the Rogibal. Either you have to do Karshana Chikitsa, Lekhana Chikitsa, Shastur Lekhanam, Vamana Chikitsa, or Panchakarma, or simple Shaman Chikitsa. Simple Shatavari Growth, if you give, sometimes it serves the purpose. Agni is very much important, the bioconversion factor. Agni Reva Sharire Pittantargataha. I always repeat this because in every conversion, Pancha Mahabhutagni, Sapta Dhatwagni, and the main Agni is important. As we go into the subject more, I will explain it there. The arm, we all know Ushmano Alpa Balatven. थोड़ी कम मात्रा में अग्नि पड़ गई, जितना अन्न ले रहे हैं उसकी मात्रा में अग्नि यदि कम पड़ती है तब क्या हो जाएगा, वह प्रॉपर बनने की
मैम आवाज नहीं आ रही है. हेलो मैम. नीता मैम, आर यू देयर?
I think, madam, there is net issue at her side. Big net issue.
Hello, ma'am.
Pradnya, ma'am,
हाँ नीता मैम.
please contact her because it seems that there is very big net issue at her side.
ओके ओके ओके.
Hello, am I audible, please?
Yes, ma'am,
Yes, ma'am.
audible.
Yeah, I'm coming back. I'm sorry again, my snapped net connections. So I'm coming to it again. I'll quickly wind up now. So I would like to say, now here we know Agni will cause proper Rasarakta mass and will not stop at Med. Then only Asti Majja Shukra are good. If Prameha Janya conditions come, it comes into Med and it is affected. So Prameha, Thalangatva, weakness, all, because Asti is the strength in the body which is maintaining your skeletal system. Now, this is the main factor I wanted to tell you about Agni, the relation between Deha and Dhatu Agni. Swasthanasya kaya agniramshaha dhatushu sanshrita. So the Agni is important in every cell. It is situated in every dhatu. Tesham saditi dibhyam. If the Agni is less, then the dhatu, upadhatu is less, and the malarupi thing form is more. So we don't want more malarup to form. We want good Agni Bal so that the Sapta Dhatu remains proper. If the Mala, Rupi, Kapha and Pitta forms more, they are going to cause Upalepanam, and which is going to cause avarot. So treat them properly. Hello, am I audible, please?
Yes, ma'am.
Yeah. So Agni is the main factor which we are going to look into. Now, Alpata, how to treat? Scanty in comparison with the whatever she is usual, whatever she had initially, flow and duration. So here it is caused by dryness of rasa dhatu. So do prenanam chikitsa there required, as there is increase in vat here. Whenever there is a alpata, dryness, you do a viruddha chikitsa, do a prenan chikitsa after Deepan Pachan, and vata chikitsa. Here Basti will help. Apply the principle of guna. There is increase in Vikruta Pitta, example in Arajaska. So here you have to use something which will pacify the Pitta. That is Dadima, Kashmari, Shatavari, which is going to help. Next is Rasayan Chikitsa. So whenever there is a problem with the hormones, after proper identification treatment, then give Rasa Ayan. Ahar gachati iti rasa. Every cell should, which is shrinken, the shrunk cell should come back to life with Rasayan Chikitsa. So you can adopt Amalaki, Shatavari, Kashmari, Yashti Madhugrut, Triphala Ghrut. So why I tell you Ghrut? Because Ghrut is a rich source of vitamin B complex. The studies you can go to the articles and find out. So that is why, and it increases Agni. This is how our people have explained how to maintain Agni with the proper combination either of Shatavari, Kashmari, Yashti Madhu or Triphala. Then Virechanam, if the metabolites are going to do avrodh, give Virechanam. Nitya Virechanam in the form of Triphala Ghrut also will help. Phytoestrogens are necessary, available in Methika, available in Papaya, available in Shatavari, available in Kumari. So all these phytoestrogens which are necessary have been mentioned as drugs. Anuvasanam. Anuvasan Basti is really important, where you find there is daily gati, daily stress. Go with Anuvasan. Matra Basti finds place because it is a Sukha Basti. You can give it at any time. Whenever the patient comes to you, initially start with Matra Basti is also okay, because it is Sukha Matra, and at any time if you give, it is going to increase the Shukra Ojas as per Chakrata. So you can adopt this and find out if there is good amount of relief in PCOS caused by Vata. Yoga Basti is of course choicest thing what we do, because Garbhashaya is in Apanasthan. The whole of the hormonal chemistry playground is in Apanasthan. This we have gone through. Now, important part of the principles of treating are, nowadays we see Rajaswala Charya is not at all being followed. Now, in Rajaswala Charya, mostly you are supposed to take light, laghu, santarpana, are mostly sweetened things. Why? Because the stratum basal has proliferated and is shedding. At that moment, vata increase. Anything going out will increase the vata. To pacify vata, madhur ras is important. So payasam is advised. So first 2 days are Agni Mandya, but in small quantities, laghu ahar, and not the thick payasam. It is very liquid type of sweetened kheer or milk is advised in Rajaswala Charya. And the parents used to say, do not go out. Now we see the advertisement with sporting advertisement. Sanitary napkin is okay for that sporting thing, but you need not go jump, because the vata is definitely going to increase. As this increase, it shrinks the cells and the hormones do not flow freely. Therefore, you find people suffering from what you say is PCOD. So the group has increased now. So this is the thing. A woman has to follow Rajaswala Paricharya. A woman has to follow Rutumati Paricharya. A woman has to follow Garbhadhan Paricharya, woman has to follow the Garbhini Paricharya and Prasava Paricharya and Sutika Paricharya. The squatting position is going to come back again now. People are working on it. So whatever has been told, Ukudu Baitke hi delivery, the gravity helps, all these things are coming back in Shashwatatva of Ayurveda. So Sutika Paricharya, the regimen followed after delivery. No matter, after exercising, you see many heroines, actresses coming back to shape. But Vata is there. And this Vata has to be combated by doing Sutika Paricharya. The principles followed again are Panchamahabhut, Tridosh. We have to follow, we know the combinations, how Vata increases, how Pitta increases, what is common between Vata, Kapha, Vata, Pitta has to be adopted in the patients. You have to look after Sharir, Manas and Atma. Loka Purush, Yatha Pinde Tatha Brahmande. So whatever dehydration in the body has to be replenished from outside. The dehydration factor has to be controlled. Samanya Vishesha Karma. The Prakriti, the phenotype is different for all. You have to be very mindful about the Prakriti. So you have to be treating the patient as per Prakriti. Because Ayurveda is customary, we cannot give one simple drug and this works on PCOS. So it is for the Vaidyas to follow the principles of Ayurveda. Hetu Linga Aushad. Find out the Hetu, whatever has been done, therefore due to which this disease has arisen, the Lakshanas has been seen, then plan the Aushad accordingly. Karya Karan Bhav, the cause and effect is there. As I told you, jumping causes, increase in Vata, which has been very well explained in our principles. So while taking history, you have to elucidate everything from the patient. What is the stress level? What is the physical point which is missing out? Ahar is of course important. The timing of eating, the way the subject is sitting and eating, with interest in food, the mind's going haywire, the mental factors thinking of the job, what is to be done next, and the boss pressure, everything is going to reflect in Ahar conversion. Nidra, of course, as I told you, the 2017, 18, 19 Nobel Prize going to the other people with principles of Ayurveda, where the circadian rhythm has been explained. Our people have given utmost importance to sleep. So it is the sleep which is going to help. People say 8 hours sleep. Yes, I sleep at 1 o'clock, get at 10 o'clock. So Brahma Muhurti is important. I am not discussing Brahmacharya here. Brahma Muhurti is important. The pineal gland activation, the hormonal activation is important. So explain the importance of Nidra to the patient. And right time sleeping, right time getting up. So that as they awaken in the night, the basal metabolic rate increases, and due to which burning out of the cells, due to which the Pitta and Vata both are afflicted. So Nidra is important. Apoptosis have been explained by our people. So the right time to eat, the intermittent fasting, getting a Nobel Prize, which is really important in life, has to be explained, and not eating when and wherever, whatever available. Achar Rasayan, the moral values carry a very big importance in life. So no guilt, so no whatever vices like getting angry, irritation, all these levels have to be measured, and we have to keep this under pace and control. Swabhava Uparamvar, that is, every cell has got a Utpatti, Sthiti and Laya, but they have to maintain, as the computer maintains with its chip. Even the DNA coded thing is in the cell replicates, the nose cells replicate, the eye cells replicate. In the same manner, Buddhi. So how to give proper Buddhi status? By following all these principles, the patient can maintain health while treating PCOS. The Kedar Kulya Nyay, whatever the patient eats, how it disposes the Gamitva has to be kept in mind while explaining them the digestive process. So we all know all these Nyay are important for us. How from Rasa you are getting Shukra, Artha, proper. Whatever you eat in the first Adi Dhatu conversion, the last is maintained. So this can be understood by the Nyaya. The arm and metabolites already I have explained how they obstruct. Upvas, fasting, again, these were superstitious, but no, once you close the kitchen and work out, you can do so many things. In the same manner, once you go for intermittent fasting, you stop with your kitchen, that is Agni. The Agni will go to the Shrutas and find out whatever metabolites have to be digested, which is maintained there. So once they come out as clay and from Mutra Vaha Shrutas, the arm comes out, the patient is free, the hormonal chemistry goes well, and the PCOS treated apne aap se. Emotional intelligence, this has to be tapped. Make the patient, the subject, understand all her controls, how to have a control and not go into irritation level, emotional status, and having sympathy and empathy both for people. If they lack, they find some guilt, and this guilt is going to affect the buddhi and the sharir, both. Nidana Parivarjan, identifying, avoiding the cause, discipline, way of life, R and VR. As per constitution, geographical conditions, age, season, day and night, they have to follow. Physical exercise, how much they are the bala status. It's not that they are doing continuous exercise in the gym. Even the PCOS will not settle. They will shape up, but the PCOS will not settle. What has to be taken into consideration? So mental, yoga and meditation is important. Physical, only Ardha Bala status. Exercise is important. Quality lifestyles, today we know the consequences, the way we eat, the way we sit, multitasking at one time is not at all good. We think this is intelligence, but Vandhyatva and PCOS are interchangeable into their conditions. So we have listed out the things. So we have to follow the benefits of Panchakarma are there. So in what season, what Panchakarma? Sometimes I told you with Gaugruta, Nasya, Prenanam can be achieved. The pituitary gets good Snehan, Vata gets under control. Then you can give Basti. Virechan as per the season and the need. Vaman as per the season and the need. And Rakta motion also is really important because Rakta is affected just after Rasa Dhatu. So 60 ml of Rakta mokshan in the season also helps. So impart knowledge to all the public. Learning ancient new health related benefits, risk you weigh and explain it to them. As per today's diet and lifestyle, adjust the techniques of Dinacharya, Ritucharya, Rajaswala, Garbhini, Sutika Paricharya. Give health support system by adopting to proper nutrition, availability of the environment and counseling to support new health promoting behaviors into our social context. Thank you. If any questions, I'm open to it.
Okay. Thank you, ma'am. Myself, Dr. Pragya Khose.
Yeah.
You covered almost all basic principles of Ayurveda to treat PCOD. There are some questions in chat box. Can I take it?
Yeah, sure.
Yes.
I'll stop sharing my screen.
Okay. First question is, in some PCOD patients, after treatment, menses get regulated, but cyst not reduced. Ovarian volume also reduced. What should be done in these types of PCOD?
Okay, the cyst is not reduced because I told you, our people have told Nashta Arthavat Vandhya. That means the Artha was there proper, but due to your conditions, your lifestyle, we have got these things into this condition. So wahan par Shastra Ullekhanam, that is Vaman Chikitsa will definitely help. And this has to be repeated by after Sansarjan Karma. Give Sanshaman Chikitsa and repeat, because once you have done properly, the cyst has to go. It has not gone, means you are supposed to, then you can treat with Kuberakshavati, some things which have been given in our drugs, which are Ampachak, because Vidradhi and Granthi, in sabki chikitsa, follow that chikitsa. I have not introduced, I forgot to introduce into my session here, the Granthi chikitsa should be followed. So Ampachak Vati and Lekhan chikitsa really helps.
Okay, thank you, ma'am. Second question is, can you guide regarding the treatment of patient of PCOS with hirsutism?
Hirsutism. Okay. Hirsutism, we say androgens have gone high. Because the estrogen control is totally lost. I believe, I don't know what I have gathered from my gurus, where our teacher used to say, Ardhanari Nateshwar. Every man has a woman in them and every woman has a man in them. So the emotional part in the woman, man is of woman, and in females, the androgens are circulating, but they have to be converted into estrogen. So modern science says theca cells. We say theca cells, the aromatase. But I forget the reference, but my guru had told it occurs in the liver. And therefore, we find fatty liver in most of them who are having all these problems. So also Kumari. Kumari works in jaundice, and Kumari works, the name itself says Kumari, works on liver. So you work out on the liver first, and hirsutism clears faster. Then as the androgen levels have to be taken out of the system as metabolites, go with Panchakarma Chikitsa. So you decide as per the patient's Prakruti, Bala, Roga Bala, season, Desh, and Kal.
Okay, okay, thank you, ma'am. Next question is, please explain how to treat PCOS with amenorrhea, dependency of hormonal therapy for onset of menses.
Okay, dependence of a hormonal thing. So here you give some hormone ready-made. See, if I'm sitting home and I'm getting my own money, I don't feel like working more. Right? Only few people who have that brain that, okay, you are not supposed to be idle. They go in and find out some things, doing something. Only few. In the same manner, if the body is getting ready-made B complex, iron, calcium, the body does not want to work. So hormonal dependent. I had some patients with debris, 10 mg, initiation, then only they used to get menses. Then some progesterone dependent. Again, go into their structure, go into their history, and work out on their rasa, ratta, dhatu. So keep these things apart, the hormonal therapies, and work out with Lekhan. Definitely it is going to work.
Okay, okay, thank you, ma'am. Ma'am, there is another question. There is when ovarian volume is less, only 2 to 3 cc,
Yes.
and M is also low,
Yeah.
then how to treat?
Okay, here we go into Balya Avastha of Harit. Harit says, if it is Balya, then also the patient will not have the same all normal physiology. So here, more Prenan is required. More Prenanam, Bruhan Chikitsa. The principle of treatment is Deepan, Pachan, Bruhan. लघु को बृहत कार्य करने के लिए बृहण चिकित्सा दी जाती है. तो मांस से मांस की वृद्धि, तो समान से समान की वृद्धि. इफ द पेशेंट इज वेजिटेरियन, गो विथ माश की दाल. सो समान वृद्धि करता है, ये हमारा प्रिंसिपल है पहला. तो उसको वहां तक पहुंचाए कैसे? रस धातु को शुद्ध कीजिए, और जो भी वह पेशेंट खाती है उसका कन्वर्जन मांस धातु तक उचित हो, और वह वॉल्यूम में इंक्रीज हो जाए, एंड फंक्शनिंग अपने आप से आ जाएगी. जैसे वॉल्यूम हो जाता है तो बृहण चिकित्सा देते ही पेशेंट विल गेट. सो वहां पर केवल इंटरनल अभ्यंतर नहीं, स्नेहन स्वेदन भी दिया जाए क्षीरबला तेल से. दैट ऑल्सो हेल्प्स. एक्सटर्नल, इंटरनल, बोथ.
Okay, okay, thank you, ma'am. Please elaborate Nisya Chikitsa in PCOD.
Okay, Nasya Chikitsa in PCOD. I also told you, if it is a lean PCOD where Prenan is required, even if the patient is a bit good contoured, but if her Vata levels have increased in history, if I found out that she is traveling more, her stress levels are more, then cow's grit inside will definitely Nasahi Shiraso Dwaram. It will go through the cribriform plate. It goes towards the pituitary. We all know steroids are all lipids. So lipid orientation and Triphala growth, cow's growth will definitely work, alternating with some stimulant. Pradhaman Nasya with Vacha, Jyotishmati, Trikatu sometimes, Ardrak Swaras sometimes, and sometimes whatever Garbhasthapak Dravya has been mentioned in our science, you can go with Durva Ghritam also. Durva Swaras also. If the patient is highly Pitta originated and due to which there is burning out of the cells, at that moment, Ghruta plus Durva. Dadimadi Ghrutam will help. Yashti Madhu, Kashmariyadi Ghrutam, that will help. Or where stimulant is required, you go with Vacha.
ओके मैडम, अदरक सोरस नस्य में हम डाइल्यूट करना चाहिए और क्या कौन से डेज में हमको अदरक सोरस नस्य देने का
Ardrak
है?
Swaras Nasya, first you initiate with Ghrut, 1 drop of Ghrut inside, and then go with 1 drop of Ardrak Swaras, another drop of Ghrut again. So this is a sandwich therapy which I practice, so that the stimulation, the circulation in the pituitary, whatever blocked due to Amalakshan, the metabolites will release. Once the circulation is proper, the cells revive. Once the cells, the hormones revive.
And on what day of menses we have to give it?
You can do only after the menstruation stops. After, because Kashyapa has very well explained, whenever you take a head bath, you are not supposed to do Nasya. So avoid those days and later on you can continue. Sometimes for stimulation, you can do after post-ovulation time also.
Okay, thank you, ma'am. There is another question. If a type of food is satmya, according to Desh, for example, consuming dahi anytime, fish or meat mixed with milk or yogurt, etc., then can we consider it as hetu of that particular disease, or is it totally considered as satmya for that person?
No. It's if it is presenting as Shita Pitta. First lakshan of Rasa Dhatu, Rasa ka sthan skin hai. Or if you see some burning sensation in the hand, if you see Amla Pitta lakshan, so it is asatmya only. So milkshakes, people say, "Are itne log pite kuch nahi hota." But as we know, the Prakriti, the Desh and Kal may be the person under stress. Definitely the patient will go into psoriasis after a considerable time. So what is written is Apta Vachan, which has to be considered correct.
Okay, thank you, ma'am. Ma'am, another question is there. Please elaborate why Anuvasan Basti and not Niruh Basti?
I have told Yoga Basti. Yoga Basti has Anuvasan plus Niruha both. But initially Niruha we cannot give. That's why I said Sukha Basti is Anuvasan and Matra Basti. Then I wrote Yoga Basti. In Yoga Basti, you have to give. Niruha Basti is a part of it. Asthapan is required. Wherever there is Adhika Dosham, then you need first, without Anuvasan, we do not administer Asthapan. Niruha cannot be given until you give oil base. Once you lubricate the system, then you give Niruha Basti. Then again alternating. So Asthapan should be given.
Okay,
Not
thank you.
lonely, not in a single sitting. Okay. I mentioned Yoga Basti, that's why.
Okay, thank you, ma'am. Next question is what all regimens and diet should follow before the intercourse?
Okay, so before Garbhadhan Chikitsa, if you go with Garbhadhan chapter of Charak, very elaborately the system has mentioned, the Sahita has given the complete thing, what has to be eaten by the man and the woman. So there, if you go and read out the chapter, you will understand definitely.
Yes, ma'am. Next question is 19 years old patient with obesity, mild PCOD on USG, high AMH levels, thin endometrial, slightly small uterus. What should be the line of treatment?
Okay, so let the child go into running practice first. The child is obese, but the Ardha Bala Chikitsa should be maintained because running will definitely improve oxygenation. Pranavayu. Pran is Tarpan to Apan. So it will clear the Apanasthan. Then what we say Laghu Santarpana. Because the child is in growing age, we cannot give her strict dietary things. And Basti, Yog Basti will help her. And mostly the Vyayam Shakti, the yoga, the pranayam, the oxygenation, and Lekhan Karma will definitely help her. So that way her hypoplastic uterus will grow The obesity has to chopped out by doing vigorous exercises, by not adopting what I should say, sitting postures and timely food. 3 times a day, not twice. Usually we advocate twice, but this one is a child. So 3 times a day, eating nothing in between, mostly should be helpful, and the diet should be congenial to the patient and should be managed, written down in the form of liquids, mostly in the nights, and full diet in the daytime. Sleep should be proper. Advocation of sleep is important.
Okay, thank you, ma'am. Next question is, please explain role of Erandamuladi Kaut Basti and Mustadi Apan Basti in PCOS.
Okay, see, both are choices, I should say. Erandamula and Musta Yapan Basti. I should say, wherever you find, it is very simple. Where you find Dravatva and Grahi, where you want to adopt, you go with Yapan Basti. And where you feel that Vat is more, Snigdhata should be given and metabolites are more. That time, Erandamul Basti will help, because again, Erand is not absorbed in the body and it removes all the metabolites, and therefore it is a drug of choice. That is Gandharva Haritaki also has that. So mostly you can use where Vat is more.
Okay, thank you, ma'am. Next question is, please explain treatment in diabetic infertility patient.
Okay, in diabetes, you work only on diabetes first. Take the history first. Find the Agni, Amu, Mala, and Shrutas. Only 4. If the Mala is sticky, go with Avipatikar. Don't be mindful of the sugar present in Avipatikar Churna, because if we try to treat from our line, we will treat that way. Then I give a specific kada, mainly of Triphala, Guduchi, Musta, Sariva, Gokshur for diabetic patients. And definitely this helps me. And wherever required, you give Basti. If the patient is thin and obese, you have to mark it and treat accordingly. So, and I adjust that Ahar mainly. I follow only the Agni. And once the Agni is corrected, mostly I go with Am Pachak Vati, Lashunadi Vati, wherever required, Shankha Vati, and Arogya Vardhini. The Lasika, the Dushit, the Dasadusha, what we find in Kushta, Prameha, are well taken care of by Arogya Vardhini, because it contains Tamra. Lekhanisdan Kutki will remove the metabolites. Proper exercising, proper oxygenation. Pranayam helps revival of the cells. Rejuvenation is by pranayam. So that way you can cure infertility.
We can add also Nisha Amlaki also, no?
Yes, definitely.
Okay. Next question is, how to treat infertility due to endometritis?
Okay, endometritis is again a conditional thing where we can say it is completely Vatash, because Shul is more there. So where in the morning I was asked one question, Uttar Basti should be given in the vagina or in the intrauterine. So in cases of endometriosis, the patient is kept in a headlock position and you have to use Bala, Guluchi, Adi, Erandamul, Thailam and 80 ml pushed into the cavity. So in such cases, the endometriotic pain, what I should say, subsides. Use Kshara Prayog. Kshara is used in such cases where the excess tissue causes lysis, absorption, and then work out for Basti to remove the endometrial, excessive endometriosis, which is causing problems. Nasya here, I have given most of them cleared with Nasya also, along with this treatment. Nasya, Kshara treatment, and Basti treatment are the line of treatment in endometriosis.
Okay, thank you, ma'am. Next question is treatment of unwanted hairs on cheek, lip, or anywhere.
Now, we know hairy attitude is androgens, hairy attitude is asti mala. So work out on asti vaha shrotas. Not only asti, rasa, rakta, mas, med. If you work on this, asti mala clears apne aap se. I have told you just now that whenever the Dhatwagni Mande is there, Mala increases and the dhatu decreases in utpatti. So Mala has increased because Meda Dhatwagni is not proper. It is vitiated. You work out on that and you will get results.
Thank you, ma'am. Thank you very much. We covered all the questions almost.
Okay.
I am now Shilpa Bulbule ma'am को invite करना चाहती हूँ. Over to Shilpa.
Thank you, ma'am. Thank you, Pradnya, ma'am. Kind smoothly handle this question answer session. On behalf of Nima Women's Forum, I extend a really hearty vote of thanks to our honorable speakers, Vaidya Neeta Mahesakar ma'am, for sharing your expertise and giving us opportunity to this wonderful lecture. This will surely going to help us in our practice. Thank you, ma'am. Thank you all the delegates for participating today's session. Thank you everyone.
Thank you so much, all of you.